Hi guys, in this video we are going to learn about the estimation of hemoglobin level in the given sample. Aim: to find the hemoglobin content of the given sample of blood or of your own blood. Principle: the amount of hemoglobin can be estimated by conversion of known volume of blood into acid hematine by addition of dilute HCl and subsequent calorimetric comparison with suitable standard. Apparatus required: Sahils hemoglobinometer, N/10 HCl, distilled water, lancet, stirrer, dropper. Sahils hemoglobinometer: a single mark pipette, hemoglobinometer pipette, for measuring 20 cubic millimeter, 0.2 milliliters, of blood. A round or square hemoglobinometer tube graduated in percentage, 10 to 140, and gram percent, 2 to 22. A glass rod, used as a stirrer. A rectangular box, comparator fixed with two solid standard colored glass rods. The opaque white background provides the necessary contrast for comparison. Procedure: with the help of a dropper, take N/10 HCl in the graduated hemoglobinometer tube up to its lowest mark, usually 10% or 2 gram percent. Prick the finger under aseptic precaution. When a drop of reasonable size has collected, hold the pipette horizontally, apply its tip to the drop and draw exactly 20 cubic millimeter of blood into the pipette, taking care that there should be no air bubbles. Take the pipette away and wipe off any blood adhering to the tip. Procedure: immediately transfer the blood from the pipette into the N/10 HCl in the graduated hemoglobinometer tube. And rinse the pipette several times by drawing N/10 HCl used for mixing the blood. Avoid foaming. Mix the contents thoroughly and leave the solution to stand for about 10 minutes for maximum conversion of hemoglobin in blood to acid hematine, brown in color. Dilute the acid hematine by adding distilled water in drops. Keep mixing it with the stirrer thoroughly. Continue dilution till its color matches with that of the standard. Before comparing the color, the stirrer should be lifted above the solution only. Note the reading of meniscus from the scale provided on the hemoglobinometer tube and express the hemoglobin content as gram per 100 milliliters of blood. Precautions: the fingers should not be squeezed to take out the blood, otherwise tissue fluid might come out, thus giving lower estimation of hemoglobin. The blood should be collected accurately, avoiding the air bubbles and rapid enough to prevent clotting. The tip of the pipette must be wiped clean of any adherent blood before introducing it to the graduated tube. Maximum development of brown color is the slow process and may take as long as 60 minutes. About 98% of the color is developed at the end of 20 minutes. It is important to wait at least 10 minutes before dilution. Dilution of acid hematine solution must be gradual with repeated stirring. Sources of error: the color which develops is unstable and begins to fade almost immediately after it reaches the peak. The color standard has a tendency to fade with time. Non-heme substance like protein and lipids can influence the depth of the color. The color matching is subjective and therefore not accurately reproducible. Normal value: normal hemoglobin content in female 12 to 14 gram percent. Normal hemoglobin content in female 14 to 16 gram percent. Disadvantage of this method: there is about 8% to 10% of error in the estimation of hemoglobin. This method does not estimate all the hemoglobins, estimate only oxyhemoglobin and reduced hemoglobin. But hemoglobin in blood is also present in other forms like carboxyhemoglobin, methemoglobin, and sulfamoglobin, which are not converted to acid hemotin, so not detected. The method is less accurate because the brown color of acid hemotin does not remain stable. 95% color of acid hemotin is formed in 10 minutes. It fades with time or fades almost immediately after it reaches its peak. It is difficult to match perfectly with the glass comparator. Visual errors can be there. Acid hemotin solution is not stable and color formation is slow. Sometimes precipitation may occur. Source of light will influence the visual comparison of colors. Color of the brown glass standard fades with time, so it is not reliable. Individual variation in the matching of color is seen. Thanks for watching. Dentology Notes. Please subscribe.